helping make your life easier. Moms Every Day.
Hey everybody, it's Hattie Cheek with Moms Every Day. We have Dr. Mozafarri with us today from Cabell Huntington Hospital. And you know, it's October. We've been talking a lot about Breast Cancer Awareness Month. You just yesterday had a big lunch and learn with people who are fighting cancer, people who've gotten over it, and all about the reconstructive surgery part of breast cancer when
Correct.
people have to have all of that done. So first, let's talk about the type of patients who are good candidates for something like that.
Well, any woman who has had undergone a breast surgery, breast cancer surgery, whether full mastectomy where the entire breast is taken away or lumpectomy where part of the breast is taken away, is a candidate for breast reconstructive surgery. Most patients are candidates, and that's one of the reasons for the broad day that we had yesterday, Breast Reconstruction Awareness Day, was to let women know about their choices regarding reconstruction.
So what are the different methods?
Basically, there are two major groups of reconstructing the breast. There is a group where we use implants to reconstruct the breast, and there is a group that we use patients' own tissue to reconstruct the breast.
That's interesting.
Yes. Now, each of them have plus and minuses, and each of them are differently, but there isn't one procedure that fits everybody. So that's why we see the patients and we customize what defect that they have, what has been done to them, and how we can go ahead and get them back to where they were before they had their cancer surgery.
Is one of the methods more common than the other one?
The implant reconstruction is a lot more common than using their own tissue, mainly because it's a lot less painful. The patients recover quicker, although the time to complete the procedure takes longer as far as overall time to completion. But patients get back to their normal daily living activity a lot faster using the expander implant method.
Do they ever worry about, since they're using their own tissue, the fact that they already had breast cancer? Do those things even link together?
They link, but not as much as worrying about the breast cancer coming back, because if we use their own tissue, we use the tissue from the lower belly or from their back to reconstruct that, and those are the areas that are not concerned for breast cancer.
Okay, and when's the best time to get breast reconstruction when you're going through that process and the diagnosis of breast cancer? We
like to go ahead and start off with the breast reconstruction as soon as possible.
Okay.
If a patient is a good candidate and we can do it, we like to do the breast reconstruction as soon as the breast surgery or mastectomy is done. We can, in the same setting, before even patient wakes up, after one surgery is done, we immediately start our reconstructive method. That would be the best. Patient goes underneath anesthesia once. Before they wake up, they already have started on their reconstructive ladder and progress, so it's much better for the patient. However, the patient has to be a good candidate for that in order for that to happen.
I would have to think the mindset, I mean, it's hard enough having to go under the knife one time, hard enough getting the diagnosis of cancer, and then having to go through all of the aftermath.
Correct.
At different times.
It is, and that's what our goal is, not only make the patient whole again, but give them what cancer has taken away.
Right.
Patients are, after mastectomy, are left with a big defect on their chest. They feel that there's a part of them missing. It's not only a physical scar where the clothes don't fit, they have to deal with the prosthesis, but it's also a very big psychological and emotional scar.
Right, we know how important it is, whether we like to admit it or not. You have to feel good, you have to feel beautiful, and that can be very tough when the feeling of being less of a woman because you don't have your breasts anymore.
Correct. So with breast reconstructive surgery, we like to go ahead and restore not only the physical appearance of the woman, but also give them the confidence that they had before this diagnosis.
What about the insurance? Does insurance typically cover the reconstructive surgery?
Yes, insurance are mandated by law to cover breast reconstructive surgery and any kind of reconstruction that has to do with breast cancer diagnosis. The Congress passed a law that mandates all insurance agencies to cover this, and there is no time limit on when this expires, as long as a patient is healthy enough to undergo anesthesia, they're a
Yeah.
candidate for breast reconstructive surgery, and insurances will cover that.
Very interesting. And if you have one breast that has breast cancer and the other one does not, how does that go?
This, as far as whether they're going to have another surgery on that breast or not, as far as the cancer, that's something that we leave to the patients and their breast surgeon.
Okay.
But if they do choose to have surgery on one side and reconstruction on one side, typically we have to do something to the other side in order to achieve symmetry for the patient and make him symmetrical.
Very good. Dr. Mozafarri, thank you so much for coming with us today. If you need any more information, just go to our website, wsaz.com. Click on the Moms Everyday link. Have a good day.